lunch coma, so we're going to start off with a little bit of an active thing, which I'm going to link back into the neuroplasticity. So if everyone gets up on their feet. So we're going to just do a basic kind of just breakdown. Neuroplasticity is, in simple terms, the ability of this central nervous system to adapt. Okay, so nice, straightforward. Everyone kind of knows what a squat is. If you have any problems squatting, you can sit this one out. So traditionally, if you go into most gyms, you'll hear random terms like squeeze your glutes, keep your core tight, engage your trans abs, engage your feet, and all this waffle, which is kind of like your internal cues. So something inside your body that you're told to do. So a basic squat. So if we think about the standard gym, if you hear someone explain a squat, keep your feet engaged, feet wide apart, hands across your chest, keep your core tight, stick your bum back, engage your glutes, and then sit down into a squat. Okay, that's come back up. So again, that's the complex, over too many cues, too many kind of things to think about version of a squat. Then if a simple way to think of a squat, hands across your chest. I'll tell you what, we'll even reach them up. So imagine holding a jug of water above your head. Stick your bum back as if you're sitting into a low chair. And back up. Achieves the same thing. Okay. Then kind of in terms of neuroplasticity, which is obviously kind of how the nervous system learns. It learns through differential learning as well, so different experiences. So this time, same squat. This time we're going to close our eyes and then squat. So obviously you're taking away your kind of vision, a bit more difficult because you're taking away something that you normally use as a balance strategy. Same goes, you can kind of look up in the air, hands across the chest, and then squat. So again, just different, a few casualties already. Alright, and then if just everyone has to sit down. So a couple of squats to get everything moving. So essentially, neuroplasticity, as I said, is the ability of the body to adapt, and the central nervous system specifically. So if you think about humans as an entity, we live in the desert, we live in Antarctica, we live in different kind of environments. So the human body is quite resilient, quite robust, as previously they were mentioned about training that resilience. So neuroplasticity in sports means that we kind of need to train this, particularly with the rehab side of things. So the ability of the brain to reorganize itself, both in structure and how it functions. So the kind of theory behind this originally started back in 1912 by Brown and Shirley, who kind of talked about how the brain can dynamically reorganize itself and its structure. So over here we have the neurogenesis, continuous development and generation, new neurons in certain brain regions. So as we're kind of growing older, obviously brain kind of tissue kind of goes through this process, and then kind of new synapses, new skills, new experiences. So hands up if you've ever kind of like, say, had to learn a new skill, and you had someone then kind of explain the skill to you. So say golf is your perfect example. And as everyone kind of, and you get someone come in and you think, right, I have a club here, I'm going to have to hit that ball, and then someone comes in and gives you loads of cues, right? Keep your chest up tall, keep your feet apart, swing back and drive through. And then you start playing it and you play absolutely shit. It's because your body's going through this kind of new synapses and this neural development. And it's much like we said with the squat. The first squat you did was, I was trying to overcomplicate it. Whereas if you give a simple cue, an external cue, or an external focus of attention, it changes the way that you learn that skill. So classically, this is, if you remember Tiger Woods a few years ago, he had a back surgery or knee surgery or something like that. And he went out, and this kid has been playing golf since he was 2-3 years of age, whatever. And he went out, and in the post interview, he had a shit game. And he went in and he said, I just wasn't engaging my glutes. And he said that he played bad because he wasn't engaging his glutes. Because I guarantee you, it wasn't him who said that. So either a doctor, a physio, or a chiropractor, somewhere along the line told him that his glutes weren't strong and he wasn't engaging it. Because he was given like an internal cue, being told, this is your glutes, squeeze them, engage them, and then drive through the ball. Whereas if that, whoever he had dealings with, told him, set yourself up, get back into your normal habits routine, hit the ball as you would normally and swing through. So that's kind of him trying to reprocess and relearn a skill. So this is kind of much here where he had the weakened synapses. So he would have been off injured, came back to the sport, had some physio or some rehab input, and then them synapses were changed, so he had to relearn them again. Strengthen synapses through repetition, obviously practice, and kind of strengthens kind of neural connections. I think this is the main benefit of strength and conditioning training. It's not per se kind of the big muscles and the actual kind of, you know, biggest most muscular athletes doesn't necessarily mean they're the best. You look at the Lionel Messis of the world, and they're the kind of small little ones, but they have quite strong neural connections because they've had that and they've played that sport and played in that manner since they were quite young. I was talking to someone earlier on about actually strengthened synapses. So your body kind of goes through a neural developmental growth spurt between the ages of 10 to 13. And that's kind of when your kids, for example, should be exposed to every single sport they can do between that age range, because that's where they kind of develop this neuromuscular control. Lionel Messi, from a footballing standpoint, during that time he had growth hormone, so his development would have been tenfold, 100-fold. If you're thinking about from a neural synapses and a neuroplasticity standpoint, that's where he would have developed quite significantly. So in this kind of synapses is kind of why then certain players kind of develop quite quickly. The repetition and the practice strengthens them kind of neural connections, and then if you think about like a neuroplasticity side of things, you want them processes to be as streamlined as possible. New synapses and new skills that's kind of from your differential learning, so you're constantly learning new skills or new techniques or new awareness of your body. So if you follow kind of rugby, Sonny Bill Williams, who's just an all-round just unbelievable athlete, plays for New Zealand rugby team, the All Blacks. He also was was a professional boxer down in New Zealand, and if you follow him now, he's literally doing every single thing to do with gymnastics type training. So he's constantly challenging his body in different sports, different codes, and he's a bit older now, but he's still playing at really high level of rugby because he's always learning new skills, new experiences, and creating new neural connections. So that's from a neuroplasticity standpoint. So the cueing and the kind of the focus of attention. Nick Winkelman is the head of athletic development at the Irish rugby team. He has loads of work. I'd highly recommend go and check out his work. He has loads of stuff on SlideShare. He has a book coming out called something about coaching anyway. But he talks a lot about this continuum, the novice versus expert continuum. So essentially this is all your motor cortex, and this is how we learn a skill. So certain parts of it related to kind of differential learning, certain parts are related to kind of that repetition, and then we obviously the primary motor cortex, which is kind of that more subconscious level of thinking. So when you start kind of see someone and then you start giving a internal cue, and I put my hand up and I'll say I've been guilty of this for far too long. When I started the physio process, you go in and say, right, I want to, as I alluded to before, protect someone's back and give them exercises that are going to make them stronger and prevent pain. So you went down the Pilates rabbit hole and learned all about trans abs and contract your trans abs and squeeze, hold this, and then kind of given loads of internal cues. But when someone's in pain, they don't know where their knee, their foot, their hand is. So if you're saying, well, raise your knee up higher when you're running, when that person's had a knee injury, they don't really know their joint position sense, so they won't know where their knee is. So Nick talks a lot about this, is you actually add in an external focus of attention. So he'd put a bit of tape on that person's knee, a bit of tape on their chest, and when they're running, he'd actually say, get them two pieces of tape closer to each other, because that's going to drive the same thing. It's going to drive the same external focus of attention. And then when they get the process and get the pattern strengthened through them synapses, you simply take away the piece of tape. So, and then kind of in terms of the experts are kind of the Roger Federers of the world from a rehab perspective. So they're ones that attribute their success as athletes due to improving the way they read patterns of their opponents. So Roger Federer, if you ever kind of listen to any interviews he does, he always talks about he can tell the way the other person's going to hit the ball from the way that they've set up, because he's probably seen someone return that tennis ball to him millions of times, and before the ball even gets there, he knows how they're going to hit it. So kind of that's where you kind of get into that expert level. So kind of in terms of rehab wise, what we need to do is kind of actually understand when you have someone, you're giving them an external focus of attention. So that'll be, for example, push the ground away. The ground's a constant. Or it might be a case of, in a Pilates type environment, on your hands and knees, you put something on their back, say, keep that on your back as you raise one hand up, one leg up. So it's quite an interesting kind of area to kind of go down in terms of understanding the coaching and the cues involved. So neuroplasticity. In order to maximize cortical reorganization provides the greatest potential for rehab success. So that's alluding to the fact that if you have someone with a shoulder injury, there is nothing wrong with their lower limbs, so get them exercising their lower limbs, because that's going to help just reprocess and reorganize this cortical representation. Because if they stop exercising, not only are they going to get weaker, they're going to get pissed off as well because they're not training, and then they're going to get more stressed, and then they're going to get more anxious, and then it can lead to a whole cascade of not only physical changes, but all the mental health side of things as well. The brain smudging is kind of where the neuroplasticity, so I've just mentioned all the positive effects of it, but there's also negative effects. So if you have kind of a maladaptive cue, when someone comes in and they've had back pain, and someone's told me, I've done 6 years of Pilates, and then suddenly they walk and they're really rigid because they're constantly thinking of, I need to contract my core to protect it. Strong core, which is not the case at all. Your core should work in almost like an automatic way. The neuroplasticity side of things, they mainly talk about obviously external focus of attention, differential learning. So that's kind of where we talk about the movement variability. So challenging your body in different ways, different kind of exercises, much like Sonny Bill Williams. There might be a case of kind of certain rugby clubs do it, where they'll bring in something completely obscure and say bring a rugby club, and they say, right, we're going to play with a basketball today, or a big giant gym ball, and it's just challenging them thinking a bit differently, playing with a tennis ball, just getting their brain and the nervous system kind of firing a little bit differently, and challenging their normal pattern recognition, because they're used to seeing a rugby ball. What happens if you actually just add in a tennis ball when I'm going to play a game with a tennis ball? Oh, sorry, I missed the brain smudging. Brain smudging obviously kind of means that if it is a case you kind of stop challenging the body and stop challenging the nervous system, it can start drifting off into other areas of the brain as well, and then they suddenly stop using their shoulder, stop moving their neck, and they kind of start processing at a cortical level them areas differently. Psychological involvement, the fear avoidance. So you have fear avoiders and fear confronters. I'm a confronter, can't swim, still go surfing, which is kind of silly and kind of annoys a few people. But in terms of a lot of people, if they're in pain, they're going to tend to avoid that fear. So you need to make sure that they have like a gradual graded exposure program to wherever that fear may be. So from a neuroplasticity side of things, has anyone ever seen that movie? It's a Pixar movie, but it's actually quite good. It's Inside Out. Yeah. So it's quite interesting because it's a Canadian girl, ice hockey player, moves home, but it documents like these little cartoon characters in her head, and then there's like the fear, there's sadness, there's like happiness, and then there's like a few other emotions, and it talks about the amygdala and how like the fear is a small little red character and it's just running around the girl's brain, and it's kind of documenting what she's doing. So from a psychology standpoint, it's worth a watch. From the fear avoidance side of things, you just need to get them doing what they're scared of, but do it in a safe, contextual environment for them. Anxiety, obviously if their anxiety's up, they can catastrophize. So they're going to be worrying about them things, so you might need to do some relaxation exercises before you get them into the actual rehab exercise itself. So kind of that's just to try and wind down their sympathetic nervous system, because if they're up here and they're kind of breathing really heavy, really anxious, really worried, high muscle tone is associated with anxious patients. And then depression, so if it is a case they're a bit down and they have kind of, feeling a bit low mood, can be low muscle tone, they're going to be ones that you need to kind of ramp up and get a little bit more excited, get them doing some kind of high intensity stuff to get the nervous system sparked and get them going from that up to that sympathetic nervous system. The psychology side of neuroplasticity is quite interesting. So kind of from the basketball side of things, the head coach of the British basketball female team is a psychology professor. So a few years ago he was doing a relaxation mindfulness session with all the players, and I came late to the session anyway, but came in and they had them all laid out on the ground and they're all doing like mindfulness, relaxation, a bit of breathing before a big game. And I went in and I just picked up 4 of them and said, drag them all out. I was like, no, get out. And he didn't say anything during the session, but he cut the corner of me after. It was like, why did you pull them? I was like, we are 2 hours away from the biggest game of the championship. She's like, the 4 players involved were like very low muscle tone, and they're very relaxed, very chilled people, and just to get them into a relaxed state and then get them ramped back up to play in a high level championship game was never going to happen in 2 hours. And I told them that it's a case of their sympathetic nervous system is way down here. They're kind of like very low muscle tone, very hypermobile. We need to kind of ramp them up here and work on more muscle stiffness and get them to that level to play at the sport and at that in the game. And I was like, they should not be doing any relaxation strategies which are going to leave them way down there. And he kind of understood that and then kind of was absolutely fine with it. So kind of it's just understanding how the person is, because the anxious ones are normally going to be the ones that come into physio or rehab and look for a massage and look for a manual therapy and look for a fix, speak very fast, and like very high tone. Generally females are more prone to this side of things. And the catastrophization is the best indicator of someone going on to develop chronic long-term pain problems. So that's kind of an interesting area to know about. Now the question, what athletes have the best neuroplasticity? So athletes, so obviously there's a whole loads of them. So in my view, gymnastics and dancers probably have the best neuroplasticity because they have more patterns, they learn new patterns, they have more awareness, they have full range of motion, they kind of expose themselves to any kind of fearful movements. Whereas someone who's a cyclist just sits on a bike and goes in a straight line, which is great, and they can go faster or slower, but they're not going to really challenge their nervous system in any other way, shape or form besides going faster or slower. So what is rehab? So rehab in essence is obviously your kind of value-based goal setting, making sure it's based around what the athlete wants to achieve. You might need to break it down for them and help them kind of set it up. Setting expectations, that's your expectations, and that's also the patient's expectations, and it might also be the coach's expectations. So it's understanding that side as well. The beliefs, so if the athlete might think they're broken and they can't get back to dunking a ball, which may very well be a concern, but you need to help them think in the short term in terms of what they're trying to achieve. And then kind of in terms of kind of an opportunity to work on any areas of weakness. So there's a story about any MMA fans here. Conor McGregor did his cruciate ligament, and then his coach realised the type of person McGregor was. McGregor locked himself up for a week, just didn't leave the house because he was pissed off. And his coach came around the house and said, "You're going to be the first person to come back from an ACL reconstruction in the fastest time in an MMA or UFC history." Lo and behold, he did. But his coach knew him that well that he had to reframe that thought process in his mind to say he was going to be the best. So he said, "Right, I'm going to turn this area of weakness into a strength because I And then you can look at that and say, right, we're going to work on speed, power, endurance, technique, whilst you're going through this rehab process. So in that way, they're not only getting rehabbed and getting back to their sport, but they're also going to actually improve on the way they play that sport. And then optimal preparation for the worst case scenario. So that's just making sure that they're prepared when they do go back to the sport to face up to the worst case scenario. So in a rugby game, that might be up and down the pitch a few times, a couple of 4 or 5 hits, and then pause, take a breath, and then do that again and again and again. So you need to be prepared from a rehab standpoint that they can withstand that pressure. Rehab side of things, I'll quickly whiz through this because I'm definitely over in a few minutes. Education, reassurance, pain management, hot topic in physio, isometrics. It's a good start, safe starting place for people if they do want to kind of know how to rehab someone. Again, it's just a case of the muscles are working, it's not too challenging for the athlete or the patient, and then it gives them the nervous system the signals that it's okay and it's safe to exercise. Progressive loading, tissue, muscle, joint, movement, person. You might need education of all the components of that. Structured training, loading programs, so that's Tim Gabbett's work, looking at the sweet spot. So again, that's looking at a acute workload, a chronic workload. So in terms of if someone goes from doing nothing 1 week to training every day for 7 days, that's going to be a recipe for tendinopathy. But if the same goes, if they go and increase their workload to train kind of from 10 days a month to 21 days a month, that might be enough just to tip it over the edge. Cross training, off on feet training, force absorption. This is where physios, I think, do quite poorly at. We don't do much plyometrics and don't go challenge people in terms of that next level from a reactivity standpoint, and then training kind of correct biomechanics, technique, gait, and all the psychology stuff I said before, just underpinning everything. So kind of making sure that you address any patients or athletes kind of beliefs or expectations at each of these stages. And then that's just Tim Gabbett's work about the sweet spot. So looking at the acute chronic workload, that injury risk, looking for that sweet spot where they're challenging their body, but they're not challenging it to the point of breaking down. So that talks about like the 10% rule. You can push it on a little bit, 10-20% rule. So making sure that they are having some discomfort after exercising, but not to the point they're in agony. And then it should all be governed by this movement zone triangle. So looking at the task and the skill, looking at the environment, and looking at the player and the person behind it. And that's pretty much it. So some good references there, mainly the Nick Winkelman side of things, and Ido Portal above his stuff. But again, he talks a bit about neuroplasticity, and that's pretty much it.